On to the COVID-19 fight here in the Badger State. UW Health's Dr. Jeff Pothof joins us now live on News at Noon. Dr. Pothof, thanks for being with us. So we were looking at our viewer questions. So what's better in the long run, they want to know, for immunity? The vaccine or just become infected and recover from the virus on your own?
You know, the data that we have right now suggests that getting vaccinated is a much better option than getting infected and counting on natural immunity. Some studies are showing that natural immunity may not develop in about 30% of people infected, especially if your case is mild. There's a study out of Kentucky that suggests that you're twice as likely to have a breakthrough infection if you rely on natural immunity rather than vaccination. So right now, if you've had COVID-19 in the past and you're not vaccinated, the best way to protect yourself, especially if your infection's been more than 90 days ago, is to go ahead and get vaccinated.
All right. And Dr. Pothof, a lot of people are keeping a close eye on something that may be promising with Merck, where they're asking for FDA approval of the pill that some people could take if they become infected with COVID-19. Do you know anything about it? Do you know anyone who's been in any trials in Wisconsin or any more about that drug?
Yeah, I don't know anyone who's personally been in the trial, but I have reviewed some of that data from that phase 3 trial, about 745 people. And what they found is if these individuals who came down with COVID and had risks for severe disease, i.e. likelihood of hospitalization, if they took this medication orally, the risk of hospitalization would decrease by half. So if you're someone who's not vaccinated and you get COVID, this is a good option. A far better option is getting vaccinated so you don't have to have COVID at all and take your chances with a medication that's 50-50.
All right, that's true. And pandemic is causing people to skip doctor's appointments. We're hearing like breast cancer or, even some other things. So what do you think about that?
You know, this concerns me because with a lot of these disease processes, breast cancer is a great example, even colon cancer, you need to get those screening tests so we can identify the disease early, whether that's a mammogram, whether that's a colonoscopy. When those things aren't done, we typically diagnose these cancers when they start causing symptoms. And by that time, treatment options are limited. Prognosis is much worse. Patients don't do as well. So if you've been putting off that mammogram, that colonoscopy, health systems know how to do this safely. You have to get these things done before it becomes a bigger problem.
Right. Yes. Thank you so much, Dr. Jeff Pothof with UW Health. Thanks for joining us this afternoon once again. You can track Wisconsin's vaccination progress and the number of COVID cases county by county. Also find a testing site near you at tmj4.com/coronavirus.